Hi, Victoria Munoz here, and I'm going to talk about transmission and progression of epidemics. You might see me refer to my phone occasionally for the questions, explain what is happening in the first slide with the test tubes, and be specific to each tube. So there are 6 test tubes altogether. The first test tube shows 10 CD4 cells as indicated in the key. CD4 cells are a type of white blood cells. They appear undisturbed and act basically as a warning to the bloodstream of infection. The second test tube are the CD4 cells appear overrun by the HIV infection, which is indicated by small red floaters. And this whole process takes place in the first few weeks of HIV and is the acute phase. There are only 4 CD4 cells in the test tube and a lot of little floaters of the HIV infection. The next 3 are progressive, indicate a progressive infection. The chronic phase, where the HIV floaters continue to take over the body. This is a chronic phase that can last 8 to 10 years. The third test tube shows only the 5 CD4 cells still and just a few of the HIV floaters. So it doesn't really, it could show up as asymptomatic, or you could have maybe a minor swollen glands. In the fourth test tube, there are only 4 CD4 cells with an increase of HIV floaters. And then in the 5th test tube, we're down to 3 CD4 cells and many more HIV floaters taking over. To finally the 6th test tube, where you can't even really see any of the CD4 cells, but there is one if you look carefully, because the rest of the test tube is completely taken over by the HIV infection, red floaters. So number 2, explain the 3 factors that affect transmission rate and relate these 3 factors to COVID-19. So the 3 factors are inherent efficiency, or inherent efficient, that discusses the biological makeup, allows one to be more susceptible or less susceptible to the infection depending on your genetic makeup. The virulence of the virus, which is how strong the virus is, and the encounter rate between the infected and the uninfected, which basically is how often one's allowing oneself to be exposed to a large group, or if the risk is higher. So in COVID-19, there were a lot of people that were immune compromised and were much more affected by the COVID-19 virus than others, and some passed away, unfortunately. For instance, if they were in the hospital for something else and they were already having some problems with their immune system, they might have been affected with the respiratory virus and even possibly died. Some other people may have just gotten the virus in an asymptomatic way and not been able to tell if they even had it or not, but only minor symptoms. The virulence of the virus was how strong it was when the COVID-19 virus came out. It was very, very strong and affected a lot of people very quickly. And but I think as it goes on, the next 2 variants seem to be a little bit stronger or unidentified. I'm not really quite sure about that, but I think as time goes on, maybe as they get the virus under control, if it's a possibility, maybe the variants become less and less there's less and less virulence. I'm not sure how to say that. So it's not as strong later on. And then encounter rate, the encounter rate between the infected and uninfected, I still concern myself about that going out to bigger groups, because some people now, with the COVID-19 maybe being less virulent, don't even know they had it. And but at the height of COVID-19, people were going out to Thanksgiving parties after isolating for so long, or Christmas parties, etc., and then coming back to work with COVID-19 virus and infecting other people. So how much of a risk they were taking, and people are people, so they did what they want, and we learned from that. So basically behavioral, how you're going to behave, and we're going where there's a higher risk, or if you're just going to isolate and stay home and have lower risk. Number 3, explain the meaning of opportunistic infections and discuss 5 opportunistic infections of HIV. So opportunistic infections are basically usually occur when there's CD4 cells, which are the infection fighting cells, and when they fall below 200 or even 500 with a weakened immune system, and that represents the early immune failure. One of the opportunistic infections that you can get through this is candida or thrush, which is a fungal or yeast infection in the mucosal area, and also mouth or ears. Second one is shingles, which can be caused by herpes varicella. I'm not sure how to say that. Varicella virus zoster, which only appears on one side of the body. And the third one can be herpes simplex virus that appears in vesicles or blisters, and if it bursts, it could happen on your finger. I guess it could happen anywhere, mostly the mouth, probably where it's a wet area. And if it bursts, it could spread the infection on the other parts of the body or to someone else. Number 4 is hairy leukoplakia, typically known as white plaques on the tongue, and appears or even feels like little hairs that you could brush up against. So a couple other opportunistic infections would include pneumonia during the AIDS stage, known as PCP or AIDS pneumonia, and cancer, Kaposis sarcoma, which is a product of herpes virus 8, identified as red, brown, purplish pigmentation on the back, or even in your mouth, or even there was a slide that indicated underneath someone's earlobe. You can also get tuberculosis in the lungs or spread to other parts of the body, but you don't have to have HIV to get tuberculosis. The next question is, how do antiretroviral drugs work to reduce the viral load in HIV patients? I'm going to try to be as specific as I possibly can. Antiretroviral drugs, or what they refer to as ARTs, act as blockers to enzymes or proteins that HIV need to make copies and send the infection through the body. So there are several classes. There are 4 classes of these ARTs. Nucleoside reverse transcriptase inhibitors, which block reverse transcriptase, which is an enzyme HIV needs to make copies of itself. Protease inhibitors block HIV protease, an enzyme HIV needs to make copies. Fusion inhibitors block HIV from entering the CD4 cell in the immune system. And the entry inhibitors block proteins on the CD4 cells that HIV needs to enter the cells. So all these, like I said, are inhibitors or blockers for enzymes and proteins. But so how do ART drugs work to reduce the viral load in HIV patients? The patient, if they are compliant and take the medicine as they are supposed to, then they can live a very long, productive year. During this time of taking, most of the drugs are about 28 days, and if they're taken in compliance, you can live a long life. But if they're not, you can build some sort of drug resistance, pardon me, and there might be a problem, so they might have to change the method. There is constant monitoring of the viral load and the CD4 counts, so they're constantly checking patients to see how they're doing, and hopefully it's a successful venture. They can never make the HIV go away through these drugs, but they can reduce the amount of infection, or even they can reduce the amount of susceptibility in one person, so they can't pass it on so easily. The other part of this is that a lot of the drugs, they used to have it kind of as a cocktail, but now they have found a way to put 2 or 3 of these inhibitors or blockers into one drug, so you really only have to take one. So that's really good. There are also newer antiretroviral drugs that they can give you as one shot, maybe once a month for 3 months or something like that. And there is one that's possibly approved for the market, and hopefully there'll be more. So there are drawbacks with all of this, is remembering to take the medicine and being on top of that, remembering to go to the doctor and get monitored, and also even if you're getting the shot, just making the appointment, and if there are so many people in the office, then it might be difficult to get an appointment. So there are variables to the whole thing. So hopefully the venture is successful. Well, I hope you enjoyed this little discussion. Thank you for listening, and today's music is brought to you by Keiko Matsui. Have a great day.